And so what is the most common patient complaint that people come to you with?
Yeah, people generally do come because it is an urban lifestyle we are leading, and mostly the most common complaint is knee pain and back pain. Knee pain actually the most common cause is osteoarthritis, in which the inner layer of the joint that gets degenerated or it is worn off like a tire. It's a worn-off tire. So people need to be educated in the sense that the tire which is now worn off has to be mechanically it has something, the root cause has to be taken care of, rather than going on to unqualified people who can do more damage rather than doing any good to the patient. So this is what I am getting right now, because unfortunately we have not, the medical science is still very primitive, as to say, the most advancements have been made, but we still know very little about human body, and that is what is giving rise to some kind of phobia or some kind of confusion in the patients, that what is going to happen to my knee or whatever, will I be able to walk, will I be able to will I be bedridden? So that kind of phobia is also there.
What is the success rate of the knee replacement surgery and what is its longevity?
Yeah, this is a very pertinent question, because this is one question which is frequently asked by everybody. What is the success rate? See, success rate as defined by literature goes up to 98%. I mean, the 98 people out of 100 will get satisfied with this surgery. But this is mostly the data which is coming from outside, where the case selection is much earlier, and as I said, when the global disease has not set in. In our scenario, which we are seeing is people are taking all sorts of, trying out each and everything, indigenous medicine, all form of other treatments. They are sitting at home, they are suffering, and when the things become so bad that they are not able to move, they are coming and getting their treatment or a knee replacement, or they are opting for surgical treatment. And at that time, the ligaments which are all around the bony part, they are also diseased, and we are not getting very good results out of it.
Okay.
Right? So I would say, if they come early and opt, I would say that a patient who is very active, who doesn't have much of the disease, and only only thing which is diseased, or which is deterring factor, is the knee. The knee is causing him to curtail his activity, and that is the person who is ideal for this kind of treatment. And in that patient, we will have almost 99.9% of success rate.
And sir, could you also tell me what is the common cause of osteoarthritis?
Basically, the cause of this degenerative disease of knee is urban lifestyle. Some genetic factors are also there, but most of it is idiopathic. That means we don't know anything about it. Mostly what we see is an urban lifestyle where the muscles have degenerated, they are not working, they are weak, and the whole body weight falls on that poor little knee. Okay. And that is why it gets degenerated very fast.
And so how can we prevent this from happening?
The old grandma saying, you have to walk, you have to do regular exercise, you have to take good food at proper time, maintain your hydration, you should drink a lot of water, some antioxidants like carrots and citrus fruits, and those fresh fruits and vegetables, which is lacking nowadays. You rely more on fast foods, and that is really not good for your health. Some exposure to sunlight, all these things actually lead to, or they the improved lifestyle is going to improve your being of the joint also. Plus, a lot of obese people which I am seeing is every kg which is added to your body goes on, and the knee pays the brunt of it. So this is the major cause, and that has to be, and lack of exercise is rampant, even in young ages.
So what is the common age group that you see that people need?
See, there are two common age groups. One, of course, is a younger person between the age of 45 to 60 who is coming up with specific problems. Specific problems means he has a pain in the inner side of the knee, or he has pain while getting up from the chair or going down the stairs. So these are people who are specific, who are having specific joint disease. As I say, the knee has three compartments, the medial, lateral and the patellofemoral. These ladies or gents or sports people have a specific problem pertaining to one of the compartments. And when these compartments are identified as having disease, and when these are taken care of, then they get pain relief very fast and they do not go into the next phase, which is the 60 plus, where the global disease is there.
Okay.
Right? 60 plus people will have a global disease. Their knees are going to be, like a O deformity. They'll be duck walking, and they will not be able to share anything. Socially, they are outcast because they cannot go anywhere. They will have to be dependent on somebody. They will be, dependent on some kind of walking aid also. And usually you will find them gaining weight, having cardiac trouble, having blood pressure, having sugar, and having trouble, gas trouble. They would frequently they will tell you that they are having a lot of gas trouble. That's because they've been taking a lot of medicines, painkillers, etc., which are causing the internal organs to fail very slowly, right? And that is why the major problem which we are facing is this only: wrong medication, wrong treatment, which is given to patients. Bensups Hospital as a consultant orthopedic surgeon and joint replacement surgeon, and it's a nice journey till now in Bensups Hospital. I've seen it usher from a sapling to a nice big tree, and it is growing at a much faster rate that I expected, because we are able to provide the people with best kind of medical facility, best care, and personalized care, which I would say, which is very lacking. Nowadays it is very lacking that you would give a person personalized care until the end of it, what we can call as after sales service probably. That we just don't believe in doing the thing as is happening in most of the centers in Delhi, but really taking care of the patient till the end, till at whatever time he requires.